The announcement many in England waited for.
We will stick to our plan to lift legal restrictions and to lift social distancing.
All of this will be gone. We're starting to remove things now.
But what does that mean in practice? At this nightclub in London, the dance floor has been closed for over a year. Surely the news was welcome. How did you feel when Boris Johnson made that announcement yesterday? How did you feel after that announcement?
Shall I tell you what Boris Johnson said yesterday? What he said yesterday was, last year, wash your hands. This year, we're going to wash our hands of all responsibility to this pandemic. It's like he hasn't given any ruling. He's basically said, well, I urge you to do this. That's not being a government. Our capacity is 1,625. So what are we going to do if 50% turn up without their passport vaccine or without their negative? Are we going to turn away 800 people?
What are your fears and concerns? For example, if there is another club that isn't doing the same rules as you're doing, what will that mean?
Spot on. That question is exactly it. It's like there isn't a ruling. So what I may decide to do is different from what another club will do, and that is the issue.
So from the 19th of July, this street will be packed again at night. There's 2 pubs here, a nightclub over there. But the rules changing on the 19th of July aren't something that everyone is looking forward to. The disability charity Scope warning that nearly 4 million people who are potentially most at risk from COVID feel as if they've been left on their own.
There are lots of disabled people who are, of course, looking forward to things opening up, but we know that some of the most vulnerable, and particularly those on the clinically extremely vulnerable list, are feeling anxious and feeling frustrated about what lies ahead.
Why do some disabled people feel that vulnerable? Why are they that concerned?
How are people supposed to look around a supermarket and know who is and who isn't vaccinated? How are they supposed to get on the train or the bus back to work and know where it is and isn't safe to sit? Those are the reasons people are feeling anxious, because the responsibility is now on them to protect themselves while everybody else continues as if this didn't happen.
The Health and Social Care Secretary on a visit to a care home today, saying there are still measures in place.
Everyone should still carry their face mask and no one should be throwing a face mask away. We're still in a pandemic. But when you've got that face mask with you, if you're in a crowded place, an enclosed space, certainly on crowded public transport, you should be using that face mask.
The NHS COVID-19 app is a vital part in the fight against coronavirus.
But a new poll shows that 1 in 5 people plan to delete this app by next week. So potentially no rules, no social distancing, and less of an idea where cases may be originating from. This current peak will have minimal restrictions different from the last, but more of the country are vaccinated. Future numbers are dependent on how people behave, and no one quite knows exactly what that may look like.
Well, earlier I spoke to Professor Graham Medley, who chairs the government's expert committee on infectious diseases, and I began by asking him how certain he could be, looking at his modelling, about what happens after July the 19th.
Well, very uncertain. Really, it's the way that people behave after the 19th of July, and if there's a huge party, then the transmission rates will get very high. On the other hand, if people continue as they are, then we will probably see the doubling times of 1 or 2 weeks as they are at the moment. But it's really unknown what it is that people will actually do.
Suppose in the good scenario that you present that the doubling time of cases sticks to 1 or 2 weeks. What does that mean?
Well, yeah, so we will be reaching a peak at some point. It's really just a question of how high that is and how long that continues. And we've never seen a peak like this before, because previously we would always have locked down, and the amount of transmission that we have at the moment is really the kind of level it was in November and getting up to January levels when we introduced those national measures, the government introduced those national measures. So we are going to see this peak at some point, and to be completely honest, it's really uncertain what that is going to look like. It's not going to peak in the same way in the same place, so we'll see different places have peaks at different times, and whether that's one sharp peak gets very high and comes down again, or whether it goes into some plateau phase is really unknown at the moment.
Why would it reach a peak at all? And therefore, why would it come down?
So it reaches a peak because there are two things that control the amount of transmission, two basic things. One is the amount of contact, and up till now, that's all we've had to be able to control transmission. And the other is the amount of immunity in the population. And the vaccination that we've done is really being able to control transmission in a way that we haven't seen before. So it's a combination of those two things. And if we make more contacts than there is immunity, then we will see transmission increasing as we are now, but vaccination is still rolling out. And so at some point, there will be enough immunity that it can cope with the amount of contacts that we're doing. And at that is the point at which it will peak.
You know, how do you feel about a decision to live with COVID after the last 18 months of constantly trying to calculate the impact? I mean, it feels a little bit like we're just kind of saying, well, whatever will be now.
So the whole epidemic is one of timing. We got to a place from pre-pandemic, and we'll get to a place of post-pandemic. And really the decision-making is about how we do handle the in-between phase, which we're in at the moment. And at some point, government will have to decide that essentially the tail end of the pandemic is what we're going to have to live with.
And in terms of the number of deaths, over the last week or so, we've heard a few different numbers thrown around. Neil Ferguson had suggested it could get up to 200. In the last couple of days, we've seen 400 a day, even 1,000 a day, speculated by some. I mean, are these numbers, I mean, from what you're saying, they're almost sort of plucked out of the air. They could go there, they could go higher.
So the impact of death is really going to be very small compared to previous waves because of vaccination. I think that up to 100 a day, maybe 200 a day is not impossible, but it might stay at 50 a day for a long time if this peak is more of a plateau than a peak. You know, beyond that is extremely unlikely, not impossible, but unlikely. But it just emphasises the amount of uncertainty that there is.
Professor Graham Medley, thank you very much.
Thank you.